Side effects of orphenadrine. What you need to know. Muscle spasms are a common health issue. They often come on suddenly and may last for only a few seconds or minutes. For some individuals, however, muscle spasms can be very painful and persistent, interfering with daily activities. To help manage these symptoms, healthcare providers may prescribe muscle relaxants. One such option is orphenadrine, a prescription muscle relaxant that helps relieve pain and discomfort associated with muscle injuries or conditions. While orphenadrine can be effective, it also carries the risk of side effects that patients should understand before starting treatment. Why side effects of orphenadrine happen? Orphenadrine works by blocking the effects of a chemical messenger in the body called acetylcholine. This anticholinergic action helps relax muscles, but is also responsible for many of the medication's side effects. While most are mild and manageable, some can become more concerning, especially in older adults or at higher doses. Common side effects of orphenadrine. When taking orphenadrine, patients may experience several side effects. These typically include dry mouth, drowsiness, dizziness, constipation, trouble urinating, nausea or vomiting, blurred vision, headaches. These side effects are not unusual and, in many cases, may improve as your body adjusts to the medication. However, if they persist or become bothersome, it's important to consult your healthcare provider. Serious side effects of orphenadrine. Although less common, some individuals may experience more serious side effects. These can include confusion, hallucinations, or rapid heartbeat. Older adults are particularly at risk, as their bodies may process the medication differently. Anyone experiencing severe or unusual symptoms should seek medical attention promptly. Less common but serious side effects of orphenadrine. While most people experience only mild side effects, there are less common but potentially serious side effects of orphenadrine that require careful attention. These may include fast or irregular heart rate, increased eye pressure, worsening of myasthenia gravis symptoms, confusion or disorientation, hallucinations, agitation or restlessness, tremors, physical dependence and tolerance with long-term use. If you notice any of these symptoms, it's important to seek medical advice promptly. How to manage the side effects of orphenadrine. If you're experiencing side effects from orphenadrine, there are several strategies that may help. Below are practical tips for dealing with 10 of the most common side effects. 1. Dry mouth. Dry mouth is often the first side effect patients notice. Staying hydrated by drinking plenty of water can help. Avoid substances that worsen dryness, such as alcohol, tobacco, and salty or acidic foods. Chewing sugarless gum, sucking on ice chips, or using over-the-counter saliva substitutes like Biotene or BioExtra may also provide relief. If these measures don't help, speak with your healthcare provider for additional guidance. 2. Drowsiness. Drowsiness is a frequent side effect of orphenadrine, especially at higher doses. Test how the medication affects you before driving or operating machinery. Avoid alcohol and other sedating substances, since they can make drowsiness worse. If daytime sleepiness interferes with your daily life, ask your provider whether a lower dose might help. 3. Dizziness. Orphenadrine can also cause dizziness. To reduce your risk of falls, sit or lie down until the sensation passes and rise slowly when moving from sitting to standing. Avoid activities that require balance or concentration, such as driving, until you know how your body reacts. If dizziness becomes severe or persistent, consult your healthcare provider, who may adjust your dose. 4. Constipation. Constipation is another possible side effect and may be dose-related. Preventive strategies include drinking plenty of water, increasing fiber intake through foods like vegetables, beans, and bran, and engaging in regular physical activity. If constipation continues, your pharmacist may recommend an over-the-counter laxative. Persistent constipation should be evaluated by a healthcare provider, as untreated constipation can become more serious. 5. Nausea and vomiting. Some people experience nausea or vomiting while taking orphenadrine. Taking the medication with food or a small snack may help reduce nausea. Avoid fatty, fried, or spicy foods, and opt instead for bland, starchy foods like crackers or toast. If nausea persists or worsens despite these adjustments, contact your healthcare provider for further support. 6. Headache. Headaches are another possible side effect of orphenadrine. If you experience occasional headaches that interfere with your routine, an over-the-counter pain reliever such as acetaminophen, Tylenol, may provide relief. Always check with your healthcare provider or pharmacist to confirm which pain relievers are safe for you. Keep in mind that headaches can have many different causes, including other medications or underlying health conditions. Your healthcare provider can help determine whether orphenadrine is contributing to your symptoms. If necessary, they may lower your dose or consider alternative treatments. 7. Urination problems. Some people taking orphenadrine may develop difficulty urinating. This is particularly concerning for individuals with benign prostatic hyperplasia, BPH, since the medication can worsen symptoms. Before starting orphenadrine, share your full medical history with your healthcare provider. If you notice changes in urination frequency or flow, report them promptly. Untreated urination problems can lead to complications such as urinary tract infections or, in severe cases, kidney damage. 8. Fast or irregular heartbeat. Orphenadrine may cause a fast or irregular heartbeat, especially at higher doses. However, serious rhythm disturbances have also been reported at standard doses. Because of this, people with a history of heart disease or irregular heart rhythms, such as atrial fibrillation, should use orphenadrine cautiously. Contact your healthcare provider right away if you notice a rapid or irregular heartbeat. If you also experience chest pain or symptoms that feel severe, call emergency services immediately. 9. Mental status changes. Mental status changes are a less common but important side effect of orphenadrine. These may include confusion, agitation, or hallucinations. Older adults are particularly at risk, which is one reason orphenadrine is generally not recommended for this age group. Since mental status changes can also be caused by other medical conditions, it's important to contact your healthcare provider promptly if these symptoms occur. Your provider may decide to reduce your dose or switch you to a safer alternative. 10. Aplastic anemia. A very rare but serious potential side effect of orphenadrine is aplastic anemia, a condition in which the body does not produce enough new blood cells. While it is unclear whether orphenadrine directly causes this condition, cases have been reported. Symptoms of aplastic anemia include persistent fatigue, prolonged infections, or unusual bruising and bleeding. Report these symptoms to your healthcare provider immediately, as untreated aplastic anemia can lead to severe complications, including heart failure. When to contact your healthcare provider about orphenadrine side effects. If you have questions or concerns about the side effects of orphenadrine, reach out to your healthcare provider or pharmacist. Many side effects are dose-related, and lowering the dose may reduce bothersome symptoms. Your healthcare team can also recommend safe ways to manage mild side effects at home. More serious side effects, such as heart rhythm disturbances or mental status changes, require immediate medical attention. Always seek emergency care if you develop symptoms that feel severe or life-threatening. Final thoughts on side effects of orphenadrine. Common side effects of orphenadrine include dry mouth, drowsiness, and dizziness. Other possible effects include constipation, headaches, and gastrointestinal issues such as nausea and vomiting. In some cases, your healthcare provider may lower your dose to help manage these symptoms. More serious side effects, including heart rhythm disturbances, confusion, or worsening of certain health conditions, can also occur. Because of these risks, orphenadrine is generally not recommended for older adults. The likelihood of side effects can increase when orphenadrine is combined with other medications, so it's important to share your complete medical history and medication list with your healthcare team before starting treatment. Understanding the potential side effects of orphenadrine allows you to make informed decisions about your health. Always follow your provider's guidance and reach out if you experience symptoms that are persistent, bothersome, or severe. If you found this video helpful, don't forget to like, share, and subscribe to HeInfo, your all-in-one destination for trusted, science-backed health information. Turn on notifications so you never miss our latest updates on medications, health tips, and wellness guidance.